Kia ora, I'm Dr. Helen Fulcher and I'm speaking with Mr. Dean Mistry, who's an orthopaedic surgeon. Hi, Dean. And today we're talking about spinal issues. So Dean, can you tell me your approach to a patient with a spinal problem?
Yeah, well, really what I tried to do with my bigger talk was talk to GPs about how to approach spinal patients that present commonly in general practice.
Yes.
With a sort of emphasis on red flag features. So, you know, we're all taught red flags at med school, but I think most of us realise by the time you get into clinical practice that those simple red flag features don't really guide you that much.
Yeah.
So one of the key points of the thing was that individual red flag features not that important, but groups of them much more useful. And then I try to encourage people to think about spinal presentations not so much in terms of diagnosis, which can get a bit confusing, but in terms of big categories. So the first category are things you want to immediately refer to, an emergency department. So, the red flag stuff. So these are people with catastrophic neurological changes, high energy traumas, signs that they're very toxic and septicemic and may have an infection. So that's a very simple first category. The second category is where you might want to send through a referral to, an outpatient orthopaedic clinic or in private to a spine specialist like me. And these are people with, who you're worried about but have intermediate risk factors. They don't need an ambulance to hospital, but neither are they someone you're comfortable sitting on. They may have intermediate risk factors for a tumour, or they may, all the common ones are just back pain that is not settling and is getting worse, or radicular pain that's shooting down legs or arms that's not getting better by about 6 to 8 weeks. Group 3 is sort of a holding basket where you're not quite sure what's going on. They're not terrible, but they're not well, so you might get x-rays or bloods. You might watch them for a month, and then you've got to move them into one of the other categories. So if they're getting worse, you go up. If they're getting better, then you go down to group 4, which is basically just analgesia, physiotherapy, watch them get better.
Expect them to get better as well.
And if they're not, then they move categories. So I understand you'll put up a slide of my categories and hopefully that'll be helpful. And if your GPs want to know more, then it was all sort of explained in detail in the talk. And we went through a bunch of cases, and I think the GPs there got better at it as we went through cases. So hopefully that's helpful.
Can I just ask about that third category? What do you do? So hopefully you're watching someone for a month or 6 to 8 weeks.
So while you're watching someone, good conservative therapy, so pain relief, education about back pain. I usually think physiotherapy is the best step, because they'll get educated about back pain and postures and lifting techniques, a good strengthening program, and I encourage particularly regular aerobic or cardiovascular exercise. So that's what you should be doing they should be doing while you're watching them. And then x-rays if you're worried about fractures or tumours, blood tests if you're worried about tumours or infection.
Okay. And what are our red flags that we should be thinking about with fractures and tumours and infection? Just to remind everyone those things.
So for fractures, high energy trauma and neurological change are the big ones. And for infection, fever and back pain, or fever and neck pain are the cardinal symptoms. And for tumour, the most important two things are a history of prior cancer and a history of significant unexplained weight loss.
Wonderful. Oh, that's fantastic, Dean, and some really practical tips for people to be able to use. And obviously they can look for help through either your talk that you're going to put up for us or contacting.
And actually I have the same talk up on my website, which is spinesurgeon.co.nz, so easy to find there too.
Wonderful. And if people need to contact you, your details are on there, is that right? Yeah. Fantastic. Thanks, Dean.
Thanks, Ed.
Okay.
Bye.
Thanks.